Well, welcome, and welcome and join us with the Lakeland Comprehensive Weight Loss Center's new virtual seminar. New times, new changes, and we're going to adapt to them and work with you, teaching you a little bit about the disease of obesity. I'm Dr. Michael Schuhknecht. I am the medical director here at the Weight Loss Center and have been doing bariatric surgery for 25 years plus. Also been in this institution here for the last 13 years.
And I'm Dr. Seth Miller. I'm a general surgeon and a minimally invasive robotic surgeon, and I also do weight loss surgery. I was a surgeon in the Army for about 12 years before getting out of the military in about January 2019 and joining the team here. So between Dr. Schuhknecht and myself, we do all the bariatric surgery for Lakeland, and between the two of us have about 40 years of experience and about 5,000 bariatric cases.
Well, thank you, Seth. What we want to do today is talk about the disease of obesity. I'm going to go through the medical side of it, the behavioral side of it, the lifestyle changes that we need to occur to make ourselves healthy and well. And then Seth will talk about the procedures specifically we do and why we do them and how we do things. We hope we answer all your questions going forward. So what is the problem with this country and with our weights? Well, I keep it quite and simple. We're not tall enough. We gauge our weights in the medical world on a term called a body mass index, and it's basically a ratio of your weight to your height. And we get a formula with it. In America today, right now, we have about 75% of us who are overweight, and about a third of us are morbidly obese or obese. So the problem is growing, and no pun intended. We have a big problem at hand. So how we live, how we eat, how we don't exercise or don't exercise well, and how we basically live. We want to teach you how to get back into good shape and good health and good wellness. This is how you calculate your BMI. If you're interested, we do need this to calculate you for surgery and for care. The easiest way is to go online on your cell phone, look up a BMI calculator, put your height, put your weight, and you'll get the exact number. This will tell you the weight or the level of obesity that you're in that time. This is the real problem with obesity. It carries a lot of bad baggage with it. There are 64 we call comorbid diseases that go along with that lifestyle, the diet, the lack of exercise that causes obesity, causes other things. High blood pressure, diabetes, metabolic disorders, PCOS, even higher risk for things like cancer. Sleep apnea, a really big killer of Americans, a silent disease related almost exclusively to obesity. 64 diseases. And the good news of all this is, folks, when you get better, when you eat well, when you live well, they go away just like the weight goes away. There's really four things that we do, why we're so heavy in this country today, and we are really heavy. Again, 75% of us are overweight or obese. That's a large number. We can be better. We've just learned bad behaviors. We learned bad lifestyles. We learned bad ways of living. And there are four basic rules of life, in a sense, that we violate, that we break. You can break one of them and still have a problem. You can break all of them and have a really big problem. So we try to teach all of our patients your individual prescription for wellness by fixing those things that you do poorly. So first and foremost, we eat too much. We've all been trained to eat till we're full. We love to eat till we're full. We see in America, a portion says it's way too big. We overeat every time we sit down. We're not supposed to eat till we're full. We're supposed to eat till we're no longer hungry. That takes us away from eating excess. When your appetite's quiet or you have satiety, we stop eating. We don't do that in America. When should we stop eating? When we are no longer hungry. Learn to eat slowly, enjoy your food. It's the most important part of life. We need to enjoy and be happy and healthy in our eating habits. So small meals and eat them more often. Portion sizes are getting bigger, very large. When I was born in 1964, average size soda was 6 ounces, and the average American had 1 a month. Now the average size soda is 24 ounces, and the average American has 2 a day. All bad calories on top of it. Everything's supersized, biggie size, oversized portions, and we indulge ourselves every day. Learn to eat till you're no longer hungry. Learn to stop eating when you have satiety, not when you're full. Number 2 is we don't eat often enough. When we say we don't eat enough, we don't eat often enough. And you ask the average American how many times a day they eat. I asked the question every all the open seminars we had, the public seminars we had. Most Americans eat once or twice a day, and the answer is 1.2 times a day. Well, we weren't designed to eat once or twice a day. Every animal on earth eats almost 6 times a day, as should we. We should never skip meals. When you skip meals or you eat infrequently, you're actually telling your body's metabolism to slow down. We want to speed back up, to burn more calories even while we're not eating. So small meals and eat frequently. 3 meals a day, never ever skip a meal, breakfast, lunch, or supper. 4-load your calories in your day. If you're a regular daytime awake, nighttime asleep person, 4-load your calories first part of the day. That way you have bigger breakfast. That way you have more time throughout the day to burn those calories out. But don't miss those snacks either. And snacks aren't things like Little Debbie's and Pops and candies. Snacks are just smaller portions of healthy foods. So small meals and eat frequently. Number 3, and this is probably where most of us get wrong in our life, we're gullible and we fall off the track quite easily. We are what we eat. That's an old saying from the dietary schools of America, and we truly are. The most potent drug in our life is the food we eat, and we need to learn to eat healthy. We in America have learned to eat nothing what I would call horse or pig fodder, animal fodder. We love our starches and our sugars. These are energy-dense foods, lots and lots of calories, but nutritionally empty foods. And those are really 2 groups of foods: sugars or sweets, pops, cookies, candies, cakes, and then the starches, the bread, the rice, the pasta, and the potato. Only one natural, and that's the potato. And I think God buried it so we wouldn't find it. But we did. We love them. America loves its French fries. Those are foods that are just energy-dense and nutritionally empty foods. So not only are you just gaining calories, which are, when we eat excess calories, we're going to store them. We store them as fat or adipose tissue. We store them as cholesterol and triglycerides within our bloodstream. We also store them in our liver as liver glycogen. Stored energy. We don't really get fat from eating fat. That was an old wives' tale in a sense, not proven ever. We get heavy and overweight and obese from eating too many calories. We also become malnourished. It's almost hard to believe that you can be 600 pounds and be malnourished. But anyone who is 600 pounds is malnourished. They ate too many energy-dense foods, not enough nutritional foods. What should we eat? Healthy, God-given foods: fruits, vegetables, meat, and dairy. And there are very few within those that aren't good for us. Most of them are good for us because in those fruits and vegetables, we carry most of our vitamins and minerals. Within our dairy and our meats, we carry most of our proteins and good essential fats in our diet. So we need to eat well, we need to eat often, and we need to eat appropriate sizes of foods. And last and finally, we need to be active. We become a very sedentary society. We learn to slow down to the point we don't take walks, we don't ride our bikes, we rely on public transportation. We get around really quick and we go a lot of places, but we don't do it on our own 2 feet anymore. We don't do it to burn extra calories off. Every calorie we eat, we have to burn. If we don't burn them, we're going to store them. And exercise has 2 very, very important functions to us. And number 1, does help us burn those calories we eat. And number 2, it helps us stimulate our metabolism. And there's a biochemical process for all these things. We're not talking just in theory. We're talking in proven facts, scientific facts, medical evidence says what we say is truthful. I'll give you my own personal experience. I've been doing this job for 30 years almost. In the last 3 months I was off, I took off 50 pounds by exercising, eating frequently, eating healthy, natural foods. Some people think I had surgery. I didn't. Not yet. And I don't want the surgery at any time. Not that I don't approve of it. It's what we do for a living. But eating and living the right way. So what Dr. Miller's going to tell you is, why do we add surgery to the practice? But the truthful basis of all of our practice is to help you change your behavior, to help you change how you eat, how much you eat, what you eat, and what you're doing when you're not eating, and as far as exercise. So Seth, I'll let you take forward from here.
Yeah, thanks, Mike. So, as you probably can understand by this point, there's a common misconception that there's diet and exercise in one corner and surgery in the other. And what we're saying is kind of like that's completely wrong. We heavily emphasize healthy diet and exercise and healthy lifestyle, and we're adding surgery as a tool to help patients achieve that. Trying to achieve that on your own without surgery is extremely difficult. And surgery is it's that impetus, that fresh start, that clean slate that helps make all those changes that you need to make in your diet and exercise habits possible. And the goal is that you make those behavioral changes for long enough that they become healthy habits. Okay? It's always going to be a struggle to keep at a healthy weight. The surgery just makes it a manageable struggle that you can overcome. So there are a few requirements for the surgery. First of all, we look at body mass index, as Mike described. So a BMI of 40 or greater makes you a candidate, or a BMI of 35 or greater with some medically related weight problem. Things like high blood pressure, diabetes, and sleep apnea are one of those common medical problems. So we essentially do two types of bariatric surgery. One's called a sleeve gastrectomy. It's considered a restrictive procedure, and we're basically just making the stomach smaller. And we also do what's called a Roux-en-Y gastric bypass, which is a little bit more complicated. We'll show you a picture in a second. But both of these surgeries are effective, but they're both stood the test of time, but both of them are just tools. And they're tools that are very effective to help you make those changes, but they don't do the work for you, and that's why we have a comprehensive weight loss center here. So in addition to our bariatric surgeries, we do offer a full spectrum of general surgery and minimally invasive surgery, things like reflux surgery that can be related to your weight loss surgery, which is important because when we're looking at a whole patient and all of their surgical problems, having that wide array of capabilities where we can take care of different issues. For instance, when you lose weight, you might be prone to develop gallstones. Well, we also do gallbladder surgery. So any surgical needs that you may have, we can certainly take care of as you proceed through this process. So the first procedure that is the most common operation that we do, it's the most common operation that's done in the United States, is the sleeve gastrectomy. Essentially what we do is we remove somewhere between 60 to 85% of the stomach, and what's left looks like a sleeve, which is why it's called the sleeve gastrectomy. So it's conceptually pretty simple. We just remove most of your stomach, and your stomach is small, and so when you eat, you get full quickly. So it makes a lot of sense, and a lot of people feel more comfortable with this option because it's more easily understood. And what we found doing some of the scientific studies is that it probably works better than expected for a couple of reasons. The portion of the stomach that we remove is also the portion that stretches when you eat large meals. So with that gone, you can't eat quite as much food. And it's also the portion that secretes a hormone called ghrelin, which stimulates appetite. So by removing that, in addition to feeling full quickly with meals, it probably helps in being less hungry in between meals as well. So the other operation that we do is what's called the Roux-en-Y gastric bypass. This is kind of the tried and true gold standard of bariatric surgery. It's been around for decades. And essentially, it's a combined procedure. So it's what we call a combined restrictive and malabsorptive procedure. So basically what we do is we create a pouch. It's about an egg-sized pouch out of your stomach that becomes your new stomach. And we bring up a limb of small intestine and connect it to that pouch. And so in doing that, when you eat food goes into this pouch, you get full quickly, and then it travels down your intestine, but it doesn't meet digestive enzymes from your liver or your pancreas until further downstream when it connects with your intestine lower. So that's the malabsorptive component to it. So with this procedure, patients lose on average 75 to 80% of your excess weight. So if you're going to ask me, well, what's my excess weight? What you can do is take your weight at your heaviest and then subtract that at your ideal weight. And your ideal weight would be something like what you would weigh as a senior in high school if you were a thin kid. Okay? And so of that excess weight, most patients lose and keep off somewhere around 75, 80% of their excess weight. It's very durable. With both these procedures, it's done minimally invasive with small incisions, and it's an overnight stay in the hospital, typically home the next day. With every surgery, there's potential complications, and in this case, it's no different. However, I would say because we are involved in, at a national and a statewide level, all our data is collected, and we have a safety profile that we can be proud of. But with any surgery, there's potential complications. In this case, leaks from the staple line or from the anastomosis, developing blood clots. Those are the sorts of things that we are concerned about possibly at the time of surgery. In the long term, there's some concern for malnutrition, which is why it's important to take multivitamins on a daily basis after these surgeries. So this slide kind of depicts the process that you'll go through, and as you can see, it's a long process that is very intensive both before and after surgery. Okay, so the before the surgery is kind of like the training for the main event. So I often say this is like the Olympic athlete who's running with a parachute on their back. Okay, so we have you come to our weight loss program, and we make you go through a lot of steps and do a lot of education with the single goal in mind that we want you to be successful. And we don't want you to just be successful in the short term, we want you to be successful in the long term, so that 5 years from now, 10 years from now, you don't have diabetes, you've kept the weight off, your sleep apnea is gone, you're able to take a hike with your grandkids. Those are the kinds of goals that we have in mind. So as you can see from this chart, there's once a month visits for about 6 months prior to the operation, and then we continue to see you after the surgery to make sure that you continue to have success and progress as you lose your weight. So we'll see you immediately 1 week after surgery, and then 1 month after surgery, and then we continue to see you for 3 months, 6 months, and every year thereafter to make sure that you have continued success and that you're being appropriately nourished. So your responsibility in coming through this program is basically to meet with us once a month to kind of go through the process and to make all the benchmarks that we set out. So that involves attending what we call shared medical appointments. And these are appointments where you come in and you'll have individual time where you meet with the nurse practitioner and with the dietitian, but you also have time in a group setting where it's a safe environment where we'll go over educational topics that are designed to bring you through the process so that by the time you get to the surgery, you feel comfortable that you're making the right decision, that you're making appropriate changes, and that you'll be successful with the surgery. So we also ask that you maintain food diaries. We ask that you engage in exercise activities to your ability and to your level, and that we aim to get you working towards that healthy diet that Dr. Schuhknecht was talking about, those 5 to 6 healthy meals a day, where we're training on making those changes before the surgery so that after the surgery, when you've had that clean slate, you can engage and initiate those changes and make those changes new habits that you can sustain in the long term. So again, with these shared medical appointments, you'll meet with the nurse practitioner, a dietitian, and they take some time. It's a bit of a commitment. So it's approximately 90 minutes once a month. So it's important to realize that everything that's done is designed to make you successful, and as much of a time commitment as it is, it's worth it in the long run. So what's next? So ask yourself, do I qualify for surgery? And most people who are interested in seeing these seminars based on their BMI would qualify for surgery, okay? And most insurance carriers will cover it. So basically the next steps as you proceed are to complete the evaluation, and there's a quiz to complete at the conclusion of this just to prove that you saw this video and you were paying attention.
And I just want to add one more bit of thanks to you for joining us. You are the most important part of this team. And Seth mentioned it several times. This is a team to care for you. We have a wonderful staff of providers here, doctors, nurse practitioners, advanced practitioners, dietitians, MAs, manager. We didn't even count her in that group. Very good group of people. We do follow several guidelines of MBSC, which is our Michigan Bariatric Surgery Collaborative. We follow the guidelines of MBSA QUIP, which is our certification here at the Lakeland Weight Loss Center. But again, the most important part of this team is you. It's a big commitment on your part. It's about loving and respecting and caring for yourself. So thank you again for sharing your time with us, and we hope we can be of future help to you.